this one, yes? All right. How are you doing? A very good morning to you. You know, I realized something, by the way, over the years, when we do these shows, my segment, I never introduce myself. Safir and Ayub. Ayub always says, I'm Ayub Abdikadir. So good morning, Willis Raburu here. Today is Wednesday. Wednesday is all about health and lifestyle, and today I want to jump right into it. And I have doctors here who are going to introduce themselves. One who people are saying is Rubadiri's sister. Victoria, I hope you're watching. You can go ahead and introduce yourself.
Santisana, thank you very much for having us. My name is Dr. Khalida Soki. I am a nephrologist, which is a kidney specialist, and I work at the Nairobi Hospital.
All right. Welcome.
Thank you.
Thank you, and also thanks for having us here. My name is Dr. Ruben Okioma. I'm a surgeon. I'm also a critical care specialist, and I'm the Deputy Medical Director at the Nairobi Hospital.
All right. Just because she's explained a bit, so what would critical care be, just to put it in context for
our viewers?
Yes.
Critical care, basically, we are talking about the ICU.
Okay.
And whenever patients are brought into the ICU, it's basically because they need some form of support.
All right.
And when you talk about support, it's for the organ failures. We are talking about the kidney today. Right. One of the reasons why patients come to the ICU is because their kidneys have failed. Okay. So our roles in the ICU is to offer support. If you are unable to breathe, we offer support with breathing. If you are unconscious, we offer support in terms of making you, able to breathe. If your liver fails, we can support the liver.
Okay.
But today we are talking more about the kidney.
Okay. All right, and then a little bit later on, of course, we'll invite you to ask any question you have, concerning the kidney. You can go ahead and do that on 22422. That's the number to send your SMS. You can also leave your name. You can also tell us where you're watching from. You can also talk to us on the hashtag Daybreak, but the SMS is 22422. That question will be up a little bit later on. You can start as early as now if you have some of those questions, and the doctors here will answer. So let's start with the basics. I don't know who will use as an example, but where is the kidney located in the body? Right.
Thank you. The kidney is hidden, I would say, in our body. We know it is within the abdomen.
Right.
And the abdomen is basically between the diaphragm and the pelvis, lower down. Right. So it's somewhere within there. But it's hidden at the back. And the best description I can use is the point where the ribs join your spine at the back. That's where the kidney is, fairly at the back. Right. We actually say it is retroperitoneal, meaning it is not within the other organs as we know them within the abdomen, right, but it's hidden back there. Mm-hmm. Possibly because of how vital the kidney is, right, that's why it's quite hidden. Okay. Because the rib cage and the spine does protect the kidney fairly well.
All right. And so, as she said, it's vital. So what's the role of the kidney?
Okay, so we like to put it simply. We can make it quite technical, but it's good for people to be able to understand. Kidneys do 6 things, and this is the way I'll usually explain it to my patients. My patients know this. So kidneys do 6 things. Kidneys remove waste. So our body is constantly making waste. As we utilize the food that we have eaten, we use it in our body, and then we are making waste all the time, and that waste is released from the organs into the bloodstream. Okay. So your kidneys remove that waste from your blood, and they make urine. Okay. So in that way, also kidneys remove water. Whatever you drink must come out. Okay. So you drink, and then you enter the bus, and then somewhere along the way you have to stop. Right. Yes, that is because whatever you drink has to come out. So the kidneys remove waste, the kidneys remove water. Then your body constantly makes acid as it is doing its daily basic functions. So your kidney has to neutralize that acid. So it's making sodium bicarbonate, baking soda, basically, right, okay? And that neutralizes the acid. Then the 4th thing that the kidney does is that the kidney does salt balance. Okay. So we are allowed to eat anything that we want because the kidney will remove whatever is required and leave your body with what is needed. Then there are 2 things that people don't know that your kidney does. Your kidney makes blood. Oh. And your kidney activates the vitamin D that you get from the sun so that you can have strong bones. So if your kidneys are not working, what tends to happen is that your bones get weaker with time. So you are in the sun, you have vitamin D, but the bones are getting weaker over time.
Okay.
Yeah.
Well, you said something there that could be like, so doctor said we can eat anything we want. So is it true, just because you mentioned nutrition and eating, people say, you know, you eat something that looks like a part of your body. So a bean's good for the kidney, for example.
Actually, do you know an interesting thing that I'd say beans are not good for the kidney?
Okay.
But as doctors, and I think this should be a take-home message, that as doctors, everything should be taken in moderation.
Right.
And anything that is taken in excess into your body becomes poisonous for you.
Right.
Do you know that if you take too much water, it can become poisonous?
Wow.
Right?
Yes.
If you take too much of the beans, that is also a lot of protein and a lot of waste that your body has to handle. So things should be taken in moderation.
Right. So everything in moderation. That should be the take-home. Everything.
Everything.
People, that includes alcohol.
Oh no, we're back here.
Just saying. Anyway, so what are some of the risk factors that, you know, affect, excuse me, kidney health, basically?
I'm sure Dr. Sok will mention more about that. But just to add to your previous question about the functions of the kidney, we must also remember that anything that we take into our body has to be dealt with by our organs, whether it's the liver or the kidney. And I wanted to specifically mention drugs that we take, and the fact that the kidney plays a very important role in getting rid of some of these drugs. Dr. Soki does talk a lot about the risk factors. So
I know Dr. Okioma is actually mentioning this because in the critical care, he gets a lot of people who have acute kidney injury. Acute means your kidneys yesterday were fine, and today they have suddenly gone into shock and deteriorated, and he has to deal with that sudden kidney shutdown, and a lot of times it is because of medications that people have taken. And these could be herbal medications, right? So there's a lot of concoctions that people take. Remember, just because something is natural, it does not mean that it is safe for you, right? I mean, snake venom is natural. That does not mean it's good for you, you know?
Right.
So there's many toxins that people do take into their bodies. And then also over-the-counter medications. Some people can react to antibiotics and have kidney problems. Some people can react especially to painkillers. And people take a lot of these painkillers over the counter. So your diclofenac, aceclofenac, all of these medications that you take, Indocid, can actually react with your kidney to give you a kidney problem. So when it comes to taking care of our kidneys, we give patients simple guidelines to follow, right? Kidneys are filters. That's what they are. Within each kidney, there is 1.5 million filters. So in your body, you have around 3 million filters. So do not think of the kidney as one organ, but think of the kidney as 3 million organs in your body. And it is about how do we take care of these filters. So definitely dehydration is not good for your kidneys. When your kidneys are healthy and we don't have a kidney problem, rehydrate your kidneys. Allow those filters to filter. And this applies especially to people who come from very dry areas, because when there is no flushing of those sieves and those filters in the body, then sediment can get there, and that's how many people get kidney stones, okay, which can block the kidney itself. So hydration is a big thing in maintaining kidney health, and then eating healthy. So generally, how to take care of your kidneys is to have a healthy lifestyle. Exercise. Do not put on too much weight, because there's something called obesity-related glomerulopathy. When all of that heaviness is sitting on the kidney, that's also not good for you, right? It can cause the filters to become under stress. And then, so eat healthy. Everything in moderation. Everything in moderation. And that, of course, includes alcohol.
Right.
Rehydrate your kidneys, and then avoid harming your kidneys. So avoid taking over-the-counter medications, avoid taking painkillers all the time. And if you are somebody who has a disease that is predisposing you to damage to your kidneys, like high blood pressure and like diabetes, the first thing to do is control your pressure and control your diabetes. Ignoring it will not make it go away. And I can't tell you, it's really very sad how many patients I get in 1 week that I have to start on dialysis, or who come in with a diagnosis already of kidney failure because they've had diabetes for a long period of time, or they've had high blood pressure for a long period of time, which is not controlled.
So how does that, because, for like example, high blood pressure, people say it is like the silent killer,
Yeah, it is. So it doesn't have pain.
Yeah, so what can somebody do, so that they don't come to see you when
Yes.
Yes.
Do you know the thing about high blood pressure that is good and bad? Is that if you control the pressure, no damage happens. You see, we're talking about high blood pressure.
Right.
You must have a blood pressure.
Right.
When you don't have a blood pressure, you end up in ICU.
Right.
But a normal blood pressure is around 120. There's a top number and a bottom number. Okay. The top number is around 120. The bottom number is around 70. Right? Now, high blood pressure is when the top number goes above 140 and the bottom number goes above 90. And in that time now, the pressure is too high. It is damaging your blood vessels. But taking one simple tablet and bringing down the blood pressure means that no damage happens. So if you are known to have high blood pressure, control your blood pressure. It's as simple as that. And if you're somebody who is known to have risk factors for blood pressure, you come from a family where everybody has blood pressure, keep on checking your blood pressure, and when you are told it's high, kubali tu, accept.
Take your medicine.
Take your medicines. Take your medication, and you will never meet me.
Right.
Of course. The question that our patients do commonly ask is, how do you relate the two with the damage to the kidney?
Yes.
And it's important when the patient is well informed how the blood pressure, how the diabetes is going to cause the kidney to fail. And in simple terms, the kidney has a lot of blood vessels. Remember, we said a lot of blood needs to pass through the kidney to be filtered, and that way you filter the whole blood. Diabetes and hypertension damage those small blood vessels in multiple organs. We are talking about the kidney, but this happens also in the heart, happens in the brain. That's why they are more prone to get strokes. It happens in the eye, and we know it happens even in the muscles and all that. That's why you find people at times getting wounds in the foot. So that understanding that this is a chronic condition, it may lead to other complications if not taken care of well. That's the message that really we hope our patients do get. I did see an article recently about Tina Turner.
Right.
May her soul rest in peace. And she did mention that she wished she understood better how high blood pressure would affect her kidney. And that's really the message.
All right. So we need to check your pressures, people, especially if you have a history of it. And, people always, for some reason, they get the readings and they're like, no, it's a one-off. But yeah, please do get checked. Let's remind you of the question. Let's put it up so that at least you can see it now, so you can ask questions. What questions do you have? That's the question over there. What questions do you have about kidney health? SMS 22422 and use the hashtag Daybreak. Question of the day. What questions do you have about kidney health? The SMS line is open now. It is 22422, and the hashtag to use if you're on social media is Daybreak. All right, so Doc, you mentioned dialysis. So again, the basic, what is it?
Dialysis is kidney replacement therapy.
Okay.
When your kidneys are no longer working, and when is that? So we have 100% kidney function. When we are born, we have 100% kidney function. And actually, we have 100% kidney function plus reserve. Okay. Think about yourself as a full tank of fuel plus a reserve tank, okay? Yes. Now, by the time you're around 40 years old, in most people, you have used up your reserve. Okay. You have used up your reserve, and men will have more reserve, women will have less reserve because of the number of filters that we have. So, but by about 40 years, most people would have used up their reserve. Illnesses when they are young, dehydration, using painkillers, being a little bit naughty at overtaking the alcohol.
Just a little bit.
Just a little bit.
Yes.
Okay, and most people have used their reserve. And then we usually see that you will lose about 1% of kidney function per year, normally, naturally. Okay? So we never needed 100%. right? And that's also why, as maybe we'll talk about later, you can give one kidney in terms of donation, right? We never needed 100%. All we ever needed for us to be completely normal in our lives is just 20% of those filters, just 20%. And sometimes that is the problem with kidney disease, that by the time you start having symptoms, your kidney function has fallen below 20%. And all this time it has been steadily dropping, we haven't been checking, and it has been silent, it's not painful. So between about 10 to 20%, we are able to try and help the kidney function using tablets. Okay, but if kidney function falls below 10% usually, then and that is the combined function of both kidneys. Moja inafanya 5%, the other one is also 5%. Then the kidney is unable to sustain its functions for the body. Now you start becoming quite sick, okay? In that case, then what we do, we take over kidney function using a treatment called dialysis, okay?
What would be, when you say quite sick, what would be the symptoms?
So the symptoms are, remember all those things that kidneys do? So the body is filled with waste, especially one called urea. And urea makes you feel like you can't eat, gives you a lot of nausea, a lot of itching, the skin even changes color, become quite dark, and that is the first thing. And then urea can also make you quite confused or very forgetful. So those are the first signs. The second is that the body starts swelling. In many people, you notice the legs are swelling. If you notice your legs are swelling, whether that is because of your kidney or your heart or your thyroid or your liver, if your legs are swelling, it is time to go and ask why that is happening. Then, of course, those are the main signs, and then maybe the sign of the underlying disease, like if it's diabetes. And then in many people who have kidney disease, most people, your blood pressure will go high. Right. So if you do find yourself to suddenly being told, especially young people in their 20s and 30s, your blood pressure is high, you must get a kidney check. And that is a blood check and a urine check, because sometimes before the blood check goes up, the urine already shows us that there is problems, okay? And that is the right time to find out you have kidney disease, because at that point we can do something about it, you see? So if kidney function falls below 10%, then we have to help the kidney, we have to take over its function, and that is by using a machine, and that process is called dialysis. Yeah.
All right. So, sounds a bit scary.
It is, but if you have gotten to that point, dialysis is life-saving. Many people actually go into denial and they say, I can't do it, dialysis is the one that will kill me. I've heard that a lot of times. Right. But dialysis gives us a bridge. It gives us time, it stabilizes the patients, it makes them feel better. And then after that, we have conversations about what next, how can we get off dialysis, how can we give you back your kidney function. Yeah.
So what would it, what would the procedure look like? So I walk in and I'll say, today is my session.
Yeah. In terms of dialysis. Okay. So for dialysis, what is dialysis? Dialysis basically means we remove a little bit of blood from the body, we clean it, and we return it in. Okay. So you have 6 liters. This is not to scare anybody, but it's you have 6 liters of blood in your body. Okay. Right. You have a lot of blood. So what we do, dialysis is a painless process. I can actually say, and if any of my patients are watching and want to comment, but I think usually when I go into the dialysis unit, I find the patients looking quite bored because you have to sit there for 4 hours and the blood is removed from the body, slowly passed through the machine, cleaned and returned, passed through the machine. And this just goes on continuously for about 4 hours. So most patients would come in twice a week. Okay. The recommendation world over is 3 times a week. And what happens is whenever you come in, we clean your blood, you go back home. Yeah, that's what dialysis is. So you come in, you have a dialysis access, which means there's a place where we can access your blood, either here or here, where we have either a catheter or we have something called a fistula. We connect you to the machine, the blood passes through, it's cleaned, and you go home.
All right.
Just to add to that, that is the more chronic kidney failure setup.
Yes.
We do have the acute setup as well, where a patient who is in the ICU, who is critically ill, also requires dialysis. And we have 3-4 different forms of dialysis. What we tend to do in the critical care unit is a more continuous form of dialysis, a little different from what Dr. Soki has described, because this is not just for a period of 4 hours. we do it, it's a more gentle form of dialysis which is done over a prolonged period of time.
Okay.
At times over 24 hours per session. And basically, as I mentioned earlier, our work is to support the organ that has failed.
Right.
So as the kidney recovers in the ICU, then we are slowly able to get off this support. And in most cases, we hand over these patients to Dr. Soki to continue the treatment. And some of them, of course, do recover fully and get off dialysis. Yeah.
So, so somebody who's of course, watching and they're like, okay, so like you said, people will say it's dialysis that will kill me. You know, those people who have those notions. What other things have you heard, like what we call myths about it, that you can dispel?
So the first is that dialysis is painful. Dialysis is not painful. The second is that dialysis is bad for you and will worsen your condition. That is not true. Dialysis itself, actually, if we did not address the lack of kidney function, it is the lack of kidney function that actually ends up patients in a lot of trouble. So the third is that dialysis is a cure for kidney disease.
Right.
Dialysis is not a treatment for kidney disease. We are actually on dialysis because, long-term dialysis, not the one in ICU, but we're on dialysis because the kidney is chronically, that is, injured beyond repair. So there's no going back. I often explain to my patients that the kidney, I give them an example of the eye, because the eye is easy to see, you know? That if you see somebody who has been hit on the eye with a stone or injured on the eye heals white, and the person cannot see. And kidneys are like that, that once there is an injury, then the kidney cannot go back. The one that happens in ICU, where many people will come and ask me, but this person's kidney function recovered. The one that happened in the ICU, the kidneys go into shock. They are damaged, yes, but they can recover. Because they're in shock, they will recover. But these things that happen over a long period of time, high blood pressure and diabetes, kidneys usually don't recover from those. So many patients come and ask me, I've been doing this dialysis for 2 years and it's not helping my kidney. And I'm like, okay. So it's for us to know that dialysis is actually a kidney. That machine is a kidney. And some of those things are things that it's for us to address.
Right, and then the other thing also, and I just thought about it now, I just sort of take you back. When you mentioned if, you know, for people to know if you have a problem, like if you had high blood pressure for a long time, come in and check. So you said you can check urine or blood.
Yes.
So what are we looking for?
So you're checking urine and blood. Yes. So remember the kidney is a filter? It removes waste. So when we check the blood, we are checking the level of waste. That waste is called creatinine. So a creatinine test is basically around, you'll find it for 300 to 500 shillings, okay? We remove a sample of the blood, we check the creatinine level. If creatinine is high, because your body is constantly making creatinine and the kidney is constantly removing it in the urine. So creatinine should not be high in the blood. But if we check in the blood and we see that the creatinine is high, we know the kidney is not removing it. So we are able to calculate percentage kidney function, something we call GFR. People will see it on their test called glomerular filtration rate. It is percentage kidney function. That's what we're going to use it as, okay? And when we are checking in the urine, the filters of the kidney are not supposed to allow good things to come out in the urine. What is supposed to come out in the urine is waste. But if we find things that are not supposed to be waste, but we find it in the urine, blood, there's never a time that blood is supposed to be waste. What is it doing in the urine? Protein. Protein are the building blocks of the body. We are always using protein. There's never a time that it should be found in the urine. It is never waste. And if we find protein in the urine, that is a problem. Okay. So we do the two of them to give us a picture of what is happening in the kidney. If we find any one of those things, then you need to see a kidney specialist.
All right, let's take a look at, I'm told there's some people who are asking some questions before we continue and talk about renal transplant and, you know, how you can live with only one kidney. Let's go ahead and take a look at some of those questions and what you're asking. So, hi, can a patient of over 75 years have a transplant?
So that's a tricky question. Ideally, we have no age limit to transplantation. We are never ever going to reject a patient for transplant because we say you are too old. There's no such thing. However, you find what we think about is frailty. That is, how strong is the patient? Do they have any other illnesses other than the kidney failure? And you find that sometimes if somebody has multiple other conditions, if they've had a stroke, if they've had a heart attack, my putting in another kidney and putting you on medications that are very heavy on you might be the thing that makes you deteriorate in the first place. So not everybody is a candidate for transplantation, okay, depending on how they are in terms of their health. You'll find many patients who have a kidney problem, but no other problem with their heart, with their liver, with anything else. Those are good transplant candidates. But if I find somebody who's actually quite frail, then perhaps my putting in that kidney, taking them through surgery, giving them those very heavy medications might be the one that causes them to deteriorate.
Right.
So I would suggest that rather than putting a blanket statement of you cannot have a transplant, go and talk to your kidney doctor about whether you are a good candidate for transplantation.
All right.
Yes.
All right, let's take a look at another one here. Right, so someone says, how do we detox the kidney? well, one consumes alcohol quite often.
I think the first question is why consume alcohol often?
Right.
Because that's by itself...
Could be an underlying issue as well.
That by itself is a concern, exactly. Yeah. But Dr. Soki did mention earlier about moderation. And the fact that these organs need to work within certain limits, whether it's your liver, whether it's your kidney. And maybe for the person who asked that question is the damage that alcohol does is not just to the kidney.
Right.
Actually, it's the liver that gets more affected because the liver breaks down the alcohol you take. So if you take too much, then you damage the liver quite acutely. But in the wrong land, you, of course, damage the kidney. And maybe I should mention about the relationship between our organs. Our organs basically work like an engine.
Right.
When one part of your engine is not functioning well, it kind of transmits those problems to the other parts of the engine. And anytime that you have damaged your liver, that also does affect the kidney because they work quite closely together. But I think the answer to that question is anything that you take in excess, including alcohol, is likely to damage not just the kidney, but many other organs. And there's no really formula you can call a detox formula. Right. I think the detox formula is don't take often.
Yeah, detox from it.
Yes.
All right. All right, let's take another one here, another question here. Someone, this is minor, says, I was diagnosed with, all right, you're going to have to help me with this. I don't know how to pronounce that.
Pyelonephritis.
Right.
Yes.
Am I beyond redemption? First of all, what is... yeah, that one.
I don't so I'm not laughing. Yeah. Pyelonephritis is an infection of the kidney.
Okay.
It is usually pus within the kidney. You might have pus, which is an abscess within the kidney. But it's basically, you have a urinary tract infection. It remains untreated, and then it goes up to the bladder, which is cystitis. So you have a urinary tract infection. It goes up to the bladder, which is cystitis, not treated, and then goes up towards the kidneys. That is pyelonephritis. Okay? So you are not beyond redemption. Pyelonephritis is easily treatable using an antibiotic. Yeah.
All right.
One thing I would mention, though,
yes,
is that sometimes maybe you have tried treatment for pyelonephritis and it is not working. They tell you you have chronic pyelonephritis. We've seen a lot of, and I think Dr. Okioma also will attest to this and has struggled a lot with it in the ICU. We have seen a lot of bacterial resistance because of the overuse of antibiotics in the community during COVID. Because of that, a lot of people are coming to us now with urinary tract infection, simple urinary tract infection, that is completely resistant to the first-line antibiotic. Augmentin is not working. Levofloxacin is not working. And now we very often, even in children, have to move on to second and third-line antibiotics because of this. The first caution there is to tell the public that not every Homa needs an antibiotic. Right? The overuse of antibiotics in the public, in the community, is giving us serious problems in the ICU. Patients are ending up in the ICU with infections that we can no longer treat. we have no antibiotics for them. So this person with pyelonephritis might have tried a first-line antibiotic, a second-line antibiotic, and it is not working. Please go in, have it be treated well, and the kidneys will recover, and you'll be fine.
Yes, so you're not minor ukosawa, you're not beyond.
You are not beyond redemption.
Help.
Yes.
All right, we'll take one more, then we'll jump back into the conversation here. This is Macau S from Nakuru. What else do I take to confirm the status of my kidneys? I think we mentioned that.
Yeah.
Yes.
Yeah. That one we have, yes.
Earlier on, but in case you just tuned in, it's urine and blood. All right. There's another one? All right, let's take another one here. This is somebody from Ruai, Gladys.
Yes.
Please explain well what you said about lack of vitamin D and the kidney.
And the kidney.
Right.
Okay. One of the functions of the kidney is to activate vitamin D. And this is not a well-known function. And many of my patients on dialysis will come and ask me about this because their bones are paining. And somebody who had started dialysis when they were walking now is not walking anymore, is in a wheelchair, cannot walk. And this is why people say dialysis is bad. But actually, let me just put it out there, that if you are on dialysis, this does not mean that you stop seeing your doctor. There are many other things in the background we are still taking care of, okay? Including the one for blood and the one for the bones that we have talked about. So how is the kidney related to the bones? You remember that children get rickets, right? And that means the bones become soft and they bow. And that's because they do not have vitamin D. So if people don't get vitamin D, they have a bone issue because vitamin D is required for us to absorb calcium from our food. Right? Now, what people don't know is that that vitamin D that you get from the sun passes through your skin, enters the blood, has to go through the kidney to become activated to start working. So that means that people who have kidney problems have a lot of vitamin D in their blood, but it is not activated, so it is not working. So in time, you know, our bones are constantly being renewed. You are using your bones every day as you walk, as you jump, as you move. So the bones need to keep on being repaired. And if you do not have calcium, if you do not have vitamin D, the bones get weaker over time. They become very brittle, they become painful, and they cannot withstand the wear and tear, and they break easily. The simple thing to do is, if you're on dialysis, make sure that your doctor is aware, and what we give you is a tablet of activated vitamin D. It doesn't have to be complicated, but we have to remember to be doing these things. Yes.
Okay. So we'll take the last and then we'll jump back to the conversation here. I know there are so many questions here. This is Robert. And you say, Doc, good morning. There is this theory that when your urine is dark brown, your kidney is being overworked as compared to when your urine is clear. Is this true?
Okay. And I love such questions. Let me encourage everybody who's asking questions to go and talk to their doctor. There are no silly questions. There are no simple questions. All questions are very valid. So this is a common misconception that we get. And actually, my kidney patients come and tell me that I did not think there is a problem with my urine because it's so clear, inaonekana kama maji. Now that is a problem because that is just water. Where is the waste? Right. Remember, the work of the kidney is to remove waste. This waste is urobilin. It is that urea. It is yellow. So your urine must be yellow. Otherwise, it is just water. Okay? So in the morning, especially, when you have not been going to the toilet, that means you have concentrated all that waste. In the morning, when you get up and you look at your urine in the toilet, please look at your urine. When you look at your urine in the morning, it should be dark yellow. It should have all that waste that you have accumulated overnight when you have not urinated, okay? During the day, as you are drinking water, a lot of water, you will dilute it. It becomes less yellow. But urine should be yellow. Of course, it should not be dark brown.
Yes.
Yeah, because I was about to ask, dark brown.
So dark brown is a whole other thing. Yeah. Yes, it should not be dark brown.
Dark brown in most cases would mean
muscle.
Your kidney is excreting too much of waste, or you are severely dehydrated. And that could also mean that you have acute kidney failure, because you produce very little urine that is very concentrated. Because one sign of acute acute kidney failure as compared to the chronic, where a patient might have normal urine output, is reduced urine output, which is usually quite concentrated and dark brown. So dark brown is not good. I think yellow is the color.
Yellow is the color.
Yellow is the color. All right.
Yes.
So let's talk about what is a renal transplant. Yes.
Yes. Remember we said that when you have a chronic kidney failure, it means your kidney is damaged beyond repair. Dialysis takes over that function temporarily, and that's why you need constant dialysis. Right. So the solution to getting off dialysis is getting a new kidney. And how do you get a new kidney? A new kidney will be gotten from someone else, and it's given to you. It's transplanted, meaning you're moving it from one person to another. It's probably one of the earliest transplants, in terms of organs to be performed by doctors. And that is, of course, because of the vital role that the kidney plays. So kidney transplant, basically in simple terms, means we are getting a kidney from one person and fixing it onto another, which basically means the blood vessels you have to connect to the new patient, what I would call the plumbing system. You have to connect the plumbing system as well to the new person. Yes. Right.
This is why I always say that people, as we pray to God, his hands are doctors. Because how else would you do all of that? All right. So how then do I know that, I can help somebody, I can donate my kidney? How do you select a donor?
So I usually have 6 criteria for my donors. And remember that for most of us, we have 2 kidneys and we only ever needed one. I usually tell my patients when they come into clinic, one of the nurses out there, she knows herself, hi. One of the nurses out there in the reception has 1 kidney, and you'll never know which nurse is it.
Right.
You can't know. Right. One of my doctors there has 1 kidney and she's just had her baby, and yes, right. And you can't know. So the thing is, for most people, 1 kidney is more than sufficient,
right.
Okay? But there are certain criteria that we have to cover. If I am taking your spare kidney, then that must mean that you have no need for your spare kidney in your lifetime, okay?
In your lifetime.
In your lifetime. Okay. So before I would even consider you as a kidney donor, right, I must do multiple tests, and usually it's 5 stages of tests that we do over some time, and we test everything. We test your heart, we test your blood, we test your thyroid, we test viral markers, we test tumor markers, we do scans, we do imaging, we do genetic tests. Wow. We have to do all of those tests. We do predictive tests to check whether you are not diabetic now, but in 10 years' time, are you going to develop diabetes? And if any of those tests come out positive, then you are not a kidney donor. And you are not a kidney donor because in your lifetime, you will need that spare. So the only person who can become a potential, we still say potential kidney donor, is somebody who is completely healthy. In fact, we call them superhuman because we have looked for all of these things and they are not there. And as kidney doctors, it is our mandate, it is our duty to ensure we have 1 patient on dialysis. We are never going to get another patient on dialysis because he was a kidney donor. Okay? But so one of our criteria to become a kidney donor is that yourself, you are completely healthy. But there are many other criteria. Right. The second is that was completely physically healthy. You must be completely mentally healthy. Okay? So we do not want somebody who put their life at risk or who will put their remaining kidney at risk. People who have had issues to do with substance abuse in the past, people who have had issues to do with major depression or suicidal ideation. Sometimes us taking this kidney puts them under more stress. We don't want to do that. It is our duty once again to take care of the donor. We will never cause the donor any harm. So that means physical harm, that means mental harm, and then that means also social harm. So when you come to be a donor, your family must agree. We are doing something good. You see, why should your family refuse? So we do not cause the donor any problem. But I would say that my first criteria, above all this, to be a kidney donor, is that number 1, you are willing There is no coercion in kidney donation. You were born with your 2 kidneys, they are working. If you don't want to give, don't give, stay with them. That's your right. Nobody can force you to give a kidney. And we get this often because I find some parents walking in with a child, they say, atanipea figo. No. That does not work. Yeah. And lastly, if I might say, there is no coercion in donation and there is no procurement of an organ. You cannot buy a kidney. You cannot buy an organ. How much would you sell it for? You see? And when that happens, when we allow such things to happen, then we start seeing problems to do with kidnapping, taking organs from other people. This is not acceptable. You cannot buy an organ. So these are the things, especially, for example, in our hospital. Before you get a kidney transplant, you have to go through a psychosocial evaluation. You must go through an ethics committee to make sure that there is no procurement and there is no coercion in organ donation. Only then can we consider you for a kidney donor.
Can then a body reject a kidney?
Yes, of course, absolutely. What is kidney rejection?
Right.
Remember that we are giving you somebody else's kidney, okay? It is not your kidney, okay? But if we trick the body by taking medicines, we trick it into accepting the kidney. We put the kidney here, by the way. Don't put it back here where the kidneys are, okay? We can trick the body into accepting the kidney and making it believe that this is your kidney. Now, our most common reason that we lose kidneys or undergo rejection is that people stop taking their medication. They don't understand that without these medicines, then the body will become aware that there is a foreigner here, and the body interprets all foreign things as bad for you and will attack it and kill it. That is what rejection is. So the first thing as a kidney recipient you must do is always take your medication, and that is medication for life.
Right.
Okay, so that is rejection.
For life.
Yes, maybe just to add to what Dr. Soki has described in terms of the assessment of a potential donor, there's also a very rigorous assessment of a potential recipient, that person who is ideal to receive a kidney. And there are many factors that maybe we can discuss in this session.
Right.
But just to mention that at the Nairobi Hospital, we do have a very active kidney transplant program, led, of course, by our very able Dr. Soki. And she has done quite a number of transplants this year, 8 so far.
Oh, we've done 11.
11.
But I stopped. I took a break this month. Mokioma is not happy with me. But I needed to relook the transplant package.
Right. So we have a package for kidney transplants. You don't have to go to India. That's, I think, what I must say. That we have the experts locally. We have the medication required, anti-rejection medication required locally to have a kidney transplant done here. Right. There are patients who have had kidneys, donor kidneys for over 20 years and doing very well. Our
oldest is 34 years, actually.
34 years.
34 years living with a
donated kidney, yes, absolutely.
Right.
Yes.
Oh, that's quite impressive. Yeah. All right, let's take a look at some more questions here and feedback. I will say that we won't get to all of them, but at the end we'll allow them to give you their contacts. But let's take a look at what he's saying. This is on Twitter at Mr. Tyrone. Is it true soft drinks cause some sort of kidney damage?
Not really. I mean, in general, soft drinks are not good for you. Okay, doctors always tell you things are not good for you. But you know that one bottle of soda contains about 12 to 13 spoons of sugar.
Wow.
Right? So think about you just taking 1, 2, 3, 13, weke maji, then you are drinking that, okay? So soft drinks are not good for you. They are not healthy. That's too much sugar. And what can happen is that you are predisposing yourself towards high blood sugars and obesity, which eventually will come and affect the kidney. Right. So remember, things in moderation.
All right. Okay, let's look at another one. Another question here. Okay. Thank you. Dorothy says, my blood pressure is always low. Is there any danger? Hers is always low.
Yes. Well, Some people naturally have low blood pressures. That tends to be, especially in women, especially in younger women, but some people have low blood pressures even well into their 40s and 50s. A low blood pressure is anything that is less than 110, the top number, over anything that is less than 60, the bottom number. Know that it is normal for you to have blood pressures that are lower than 110 when you are in your 20s. That is absolutely normal, and children will have much lower blood pressures, okay? So a lower blood pressure only causes damage in terms of sometimes we do not get blood pressure getting to the vital organs. So sometimes the blood pressure can go so low that you can feel dizzy or you can feel weak. So we have ways to boost that blood pressure, but usually low blood pressure is not as much as a problem unless you are sick, because some people have very severe illnesses and infection where their blood pressure goes very low, which is abnormal for them, and they end up as Dr. Okioma's patient.
All right. So then you have Nelson from Kisumu, who's asking this question. Nelson from Kisumu is asking, apart from dialysis, is there any medicine to clean blood in the body?
So this is a good question, because unfortunately there are many people out there making promises that they are going to clean the blood from their body, from the body. There are two excretory organs in your body. Let's remember how the body works, that we are constantly making waste. So as we are constantly making waste, there are two organs in the body that remove this waste. One is the kidney, the second is the liver. These are the detoxifying organs, so you don't need any detox, okay? Right. These are the detoxifying organs. Yeah. So liver usually removes drugs and things like that. Kidney removes these products that we are the one who is making, okay? So now if we have waste in the body, there is no other way for the waste to come out unless we actually remove the blood and clean it like we do in dialysis. I have seen people promise that if you go and you sit in a hot tub or a sauna, you can sweat the waste out. You cannot. You cannot. You cannot.
Or there's also this thing where you step
on something, it changes color, and that is still through the skin. You cannot remove these toxins through your skin. Otherwise, there's people who are washing clothes or washing dishes, they would be removing toxins. This does not happen. Yeah. So what we usually do, I told you that between kidney function 10 to 20%, you find that there's medicines that we can help. The medicines that we can help try and remove this waste, some of them through the intestine, so that it comes out in the stool. The third excretory organ, I would say in some way, is the stool. But the stool is just removing the undigested products. But what we try and do is we try and pull out some of that waste, like urea, through the stool. There's some medications for that. And then we use your diet to adjust the amount of waste that you are making. And we use some medications to adjust your salt. And so slowly using medications, we take over the kidney functions. Right. But it does get to a point where the medications may not be enough.
Right.
Yeah.
Right. Yes. So we have time for just a few because we have
Can I make one last statement?
Yes, go ahead, go ahead.
That if somebody comes up to you and tells you that they are going to treat your kidney failure, or they are going to treat whichever organ failure it is, then they tell you either through prayer or through some medications they are going to do this, and then they tell you don't check. If you are treated, if you are cured, then your creatinine level would go low. If you are cured, then your urea level would go low. If you are not urinating and somebody has cured you through some means and now you must start urinating. If this has not happened, as a doctor, if I treat you, then I would tell you, go and check your blood and see things have improved. If somebody has promised to treat you through another means, if they have told you don't check, you know we get this a lot, umetibiwa, don't check, don't even bother checking now, please check. Because when you check, then you can see this is not working. Right. And I mention this because we have actually lost patients who say, I am now well, and then don't go for their dialysis or don't take their medicines with disastrous consequences. It doesn't have to be like that.
Yeah.
Yeah.
All right, always check. Yes. Believe but verify.
Yes, believe but verify. Yes, that is a good statement.
Yes, in fact, that's the way. Kwanza kama umeombewa, see, let's check ndo Yeah, all right. Let's take a look at another, which should probably be the last one because of time. Let's see. Oh, it's a comment. Okay, so somebody says here, Dr. Soki explains very well and in simple terms that a common person can relate. Very helpful. Right. All right. Then, yeah. Raburu, those are the best consultants. They're answering the questions very well, very informative. Thanks. All right. Good stuff. Okay. So, of course, because there are so many, questions, where would people, find you, whether it's social media or, yes, hospital or yes?
Doctors tend to be very poor with social media. But I work at the Nairobi Hospital. Okioma is my boss. Huh? Okay. So
we work at the Nairobi Hospital.
Yes.
She runs our kidney unit,
right.
Our renal unit, as we call it. She runs the transplant program. Anyone who needs a transplant, the expert is here. We are available through the normal official channels at the Nairobi Hospital.
Okay.
Yes.
All right. Well, thank you very much. In case you have a very serious case and you can reach me on social media, I will then reach out to them as well. But I would like to say thank you so much for coming, sharing, talking through this, and like the viewers have said, explaining it in terms that they can understand. Most of the times, it gets lost in a lot of jargon. People are afraid to ask, but I'm glad you said no question is
silly.
Silly. Yes. So keep on asking those questions, even if, let's say, you're in Kisumu or Kapsabet, or whatever. But I'm sure there's an email on the site. You can also reach out to them as well. And these days, as my good friend Terence Creative says, unaweza weka katika Zoom. Unaweza panga hata Zoom for a consultation.
Yes, of course.
That was one of the benefits of COVID, apart from the ruining the antibiotics formula. All right, but thank you so much. In case you have any questions, if you're just tuning in right now, we've been talking about kidney health. You can watch this later on YouTube, on our Citizen TV digital platforms as well, and Citizen Digital. Make sure you download the Citizen Digital app as well and get more information. Now, tomorrow is a holiday, I believe. Cindy? Yes, tomorrow is a holiday. Therefore, we shall not be cooking tomorrow. So, Kesho, you can look at the past episodes of What's Cooking. Surprise your loved one with a nice, healthy meal done in moderation. All right? Thank you so much. Make sure you also follow me at Willis Aburu. Peace and love to Onan.